I'm Dr. Ronald Troxell, and I'm a podiatrist specializing in foot and ankle surgery with Advent Health North Pinellas. I have 2 offices in Palm Harbor and St. Petersburg, Florida. I specialize in foot and ankle surgery, including complex reconstruction, sports medicine, and bunion corrective surgery. Today's talk is focused on bunion surgery in particular. We're going to go over what exactly a bunion is, what are some of the symptoms, when you should, as a patient, seek care, some of the underlying causes of a bunion, treatment options, and expectations for a normal postoperative course. To start, bunions are progressive deformities of the forefoot. Commonly for patients, you look down and you see a large bulge on the side of the big toe. It commonly starts that way. Most of the time it's not painful to begin with, but as it progresses it becomes increasingly more painful, causing irritation, specifically with shoe wear and ambulation. Bunions are more than a bump, but we'll get to that through the course of this talk. Your entire body weight is walking and acting on these bunions, so they do hurt. Some of the symptoms associated with bunions include pain, swelling, inflammation, pressure and numbness, sharp shooting sensations, or pain with long periods of standing, commonly seen with patients such as nurses, doctors, or anyone in general who are on their feet for an extended period of time. There is a genetic predisposition for bunions, with about 84% of them having some sort of familial inheritance, meaning you can ask your mom, your sister, or relative, and they may have suffered with a bunion deformity as well. It's actually related to a biomechanical imbalance, and that's just due to the nature of the foot being more complex than we necessarily give it credit for. Footwear in particular can aggravate and cause acceleration of these conditions, causing the toe to shift over. We commonly see this in shoes such as high heels or flats, which have a more narrowed toe box. Bunions are in fact progressive, and they do not go away on their own. They do not correct on their own, and they will progressively get worse with time. Because of the progressive nature of the deformity, they will get worse with time. This can lead to arthritis of not only the joint of the big toe, but a more proximal joint as well. Leads to not only arthritis, but toes crossing over as well. This leads to an instability of a ligament called the plantar plate, which is much more challenging to definitively correct. So in addition to these hammer toes, we also get bone spurs, and there can be transfer metatarsalgia or pain on the underlying surface of the ball of the foot. Conservative treatment options include toe spacers, which can help to accommodate any sort of transfer lesions that may be occurring due to noticeable abutment of the great toe against the second toe. Pads or splints, which aren't very effective, and inserts, which can help prevent the rapid acceleration of the deformity, but they in themselves do not actually correct the deformity. Once again, bunions are more than a bump. A misconception is that the bunion is a hypertrophy or an overgrowth of bone that can be simply shaved off. In fact, a lot of previous surgeries have been focused towards just shaving the bump off, and then we as a collective field were wondering why bunions were in fact recurring. Bunions are caused by an unstable joint in the middle of the foot, which allows the bone to rotate and drift over time. Procedures therefore directed at just shaving the bump do not inherently fix this deforming force, so that is why they tend to come back or return out of nowhere. 87% of bunions, in fact, are misaligned in 3 dimensions, meaning that there is a rotational component to the large majority of bunions that we are treating. Bunions are in fact a 3-dimensional problem, and it's due to rotation at the tarsal metatarsal joint. Due to this unstable rotational foundation, if we do not address this surgically, then the likelihood of bunions reoccurring is very high. So a few images here to further help drive that point home. Due to this 3-dimensional problem that we have addressed, surgeries now are more geared towards addressing this as opposed to previous surgical choices, which were more of a 2-dimensional fix. The gold standard was to shave the bump down, shift the metatarsal head over, and fixate. The problem with this was due to not addressing the three-dimensional component of this deformity, the bunion ultimately recurred. So when I say recurred, we're talking about a 12 times likelihood of recurrence if the 3D deformity is not addressed, with 1 in 3 patients being dissatisfied after traditional bunion surgery, and up to 70% of these osteotomy 2-dimensional patients experiencing recurrence over time. When we say recurrence, we mean the bunion comes back, potential for further surgery, further operations, etc. So treatment options that will address this 3D rotational component, specifically Lapiplasty. So this is a 3D bunion correction system. It stores the natural anatomy of the foot. It focus is to rotate the toe back into a rectus alignment with permanently securing this with stable fixation at the tarsal metatarsal joint. Through rotational correction of the deformity and stable fixation, we prevent these bunions from recurring. So here's an example of postoperative imaging for, on the left, a two-dimensional bunion surgery that traditionally is done in the past, but also still being done today. The red circle is highlighting the instability that still is present at the first proximal tarsal metatarsal joint, where that's creating the opportunity for the bunion to recur. On the right is a traditional Lapiplasty postoperative patient where there's stable fixation across the tarsal metatarsal joint, which is going to help through osseous union prevent the recurrence of the bunion itself. So clinical before and after photographs of what this entails. So I mentioned before the stable fixation across the construct. So one of the most common questions I get asked by patients is, what kind of hardware are you putting in me, and am I going to set off metal detectors at the airport? So these are titanium plates, meaning, sorry, that's just not going to happen. But the titanium allows it to be more lightweight, more thin, and more streamlined, while also imparting the same amount of strength as stainless steel, if not even stronger. These plates are contoured and anatomically shaped. And this construct uses two plates for more stable type fixation. It also incorporates locking screws, which allow for further prevention of hardware failure, meaning screws don't back out as commonly, but also allows for earlier weight bearing. So the recovery period for this type of procedure, everyone is a little bit different in their postoperative course, but for me personally, the first 2 weeks your weight bearing is tolerated in a walking boot. I do tell my patients, stay off of it as much as possible. I want you icing, I want you elevating, and that's just to limit the postoperative edema and swelling. You'll see me in office in 2 weeks. Your stitches will come out and we'll get you fully walking and weight bearing in the walking boot itself. You're able to remove this, you're able to shower, you don't have to sleep with this on, but anytime you're up and walking, you're wearing the boot. At 4 weeks, we transition you out of the walking boot and into a surgical shoe. The reason for this is there is going to be postoperative edema that is present, and your foot is likely still too swollen to allow you to go back into your normal shoe. Generally what I'm seeing is that around 6 to 8 weeks, the swelling has subsided enough and is approaching normal to the point where you're able to get back into a normal shoe. Advance your activities as tolerated. Pretty much between 10 to 12 weeks, you're back to doing the things that you want to do. So as we sum this up, know your options. Depending on where you go, a lot of physicians are still doing the old type of traditional two-dimensional bunion type surgery, and they're still having the results where the rate of recurrence is as high as 70%. So, Lapiplasty 3D bunion correction surgery has allowed us to have more reproducible results. Rate of recurrence is around 2%. That's pretty powerful when you compare that to 70% from the previous surgeries. Thank you for joining us here today at Advent Health North Pinellas, where we are establishing a center of excellence for Lapiplasty procedure. We will now take some questions. Yes, there will be an incision. In general, it is about 3.5 centimeters long. It is localized over the first tarsal metatarsal joint, which on this bone model, if you imagine this is the big toe, this is the actual joint that we're working at. So the incision would be about that big in the region there. Depending on any other ancillary procedures that we may have to do, then there would be additional incisions, meaning if we have to do hammer toes, then there would be small incisions over the top of the toe. Depending on how bad and how large the actual bump is, if we need to do any work at the actual first metatarsal phalangeal joint itself, then there would be an additional incision over there as well. Yes, this is a planned outpatient procedure. Generally, you will come in approximately 2 hours or so before the procedure. The operative time is generally around an hour to an hour and a half, and then once you're fully recovered and meet the discharge criteria, you will be sent home the same day. Generally no, and that is because we are weight bearing you immediately day one. Most of my patients are back into a normal shoe at 6 weeks. I encourage that if patients do want to undergo any sort of formal rehab at that time, then I will gladly allow that, but in general I do not see any need for that from my patients.
Thank you for joining us for this Advent Health virtual seminar. Please be sure to leave a comment below if you have any questions. If you would like to schedule an appointment, please give us a call.